So we were talking about the application of psychoanalysis to the periodic table.
Right.
So as I said, the first row from Kohut's idea is of acknowledgement and attention. Second, we'll have to bring in Margaret Mahler, fusion individuation. Third is Kohut's ideas of acceptance and affection. So the 5 A's, the first 2 A's go in the first row. Third and fourth go in the third row. And the fifth one, admiration, goes into the fifth row. And again, the fourth row, we'll have to bring in our ideas of safety, adequacy, trust, and confidence. I am not good enough. Is the world a safe place?
Right.
So we have to bring in ideas of safety, adequacy, trust, and confidence, and the idea of I am not good enough here. Fifth row, creativity and admiration. Kohut's ideas. This one will have to create a concept, a consolidated anchor adequacy. And midlife crisis. Because this responsibility thing is also a midlife crisis part.
True.
So we'll have to create a new concept, consolidated anchor adequacy and midlife crisis. And the last one is a death instinct crisis. Now, if you look at it from the column point of view, we can look at it in a way that Kohut puts an axis of the ego strength. And he says the most fragile self is the psychotic self, which disintegrates on its own or with light stress. And then you have the borderline self. And then you have the narcissistic self. Then you have the normal self. And then you have the strong self. Extreme disintegration to extreme cohesion. So if you look at the column story, it looks like that story. On this side, if you look at column 1, 2, 3, or at least column 1 looks like more like the psychotic self. Column 3, 4, till you reach the plateau, just before you reach the plateau. So for example, if we take column 3, then from Kohut's point of view, these two will be the examples of psychotic self. This will be more like the borderline self. Will be the this will be the normal self. This will be the narcissistic self. And this is the strong self. So the normal self will come in between the borderline self and the narcissistic self. Because it's not a linear thing, it's a sinusoidal thing. So if you look at from Kohut's point of view, the row story is a mirroring failure story. And the column story is a ego cohesiveness or a ego strength story. Not exactly, but roughly speaking. In the rows, we have to add other theoreticians, other concepts. In the column story, we have to look at the sinusoidal thing, not the Kohut's linear part, but the concepts are there. The order you can change. So another way of looking at it would be the left side is the entire side. If you take all of them together, these are various colors and flavors of dependence.
Okay.
All the rows and columns that you can take, these are various colors and flavors of dependence and various stages of healing of the dependent. The rows are colors and flavors, and the columns are the various stages of healing of dependence. So till you reach the healthy person, this is from the left a dependent story, the colors and flavors of dependence. So the rows present to you the various colors and flavors of dependence, and the columns present to you the healing stage of the dependent. Till you reach the peak, the healthy person, and one or two columns where you see the healthy person. And then the narcissistic range begins. So you have the dependent range, the normal range, the narcissistic range, and then this, how do we call it? We can call it regression to primary narcissism, partly or fully. We can call it spiritual transcendence. We can call it a profound reality acceptance. So this is how the story will unfold if you put together Margaret Mahler and Kohut. Now comes the question of chaos and stability. This left side is more a side of chaos, and as you go towards the right, it becomes more and more stable. The disintegration goes down. Now, that stability may result in normalcy, it may result in narcissism, it may result in noble status. But it's definitely not as disintegrating fragile as it is on the left side. So you can also see ego cohesion moving from left to the right. Now, so this is also a story from chaos to stability, dependence to narcissism. And in this row of creativity and expression, it will be from latent histrionicity to histrionicity. From responsibility avoidance to group domination in this column. If you use domination submission axis, the left will be more submissive and the right will be more dominating. In between will be the normal. So we'll have the submissive, the normal, the dominating, and the noble. If you use Winnicott's ideas of disorganizing to unorganizing, then this, till you reach creativity, it is all disorganizing at play. In creativity, you reach unorganizing, and again, the disorganizing starts in some way, at least in the last one. So this,
and what you're referring to is a set of symptoms in the repertoire.
नहीं, ये जो है rows, from if you apply Winnicott's ideas of disorganizing and unorganizing. So he talks about organizing, disorganizing, unorganizing. So
that I got it, but when you go downwards, for example, this is FR. I don't know what is FR. FE. I don't know what it is.
So radioactive elements.
Okay.
Which are self-disintegrating, and in the potential form, they make you feel death instinct crisis.
Okay. So in the already these traits are mentioned in the repertoire of the usage.
Yeah. Correct. Correct. So what you have is 1, 2, 3, 4 is the attempts at organizing. This is disorganizing. Sorry, unorganizing. This also is partly unorganizing, partly disorganizing, and this is disorganizing. If you use those kind of concepts.
What will be here disorganizing and unorganizing? It is to do with the self. Is it to do with what is this disorganizing about?
It is to do with the self. So he talks about the true self and the false self. And the idea he uses, Winnicott uses, is the idea of organizing, unorganizing, and disorganizing. Like in the self formation, you have the process of organizing. You slowly come to create a self. In disorganizing, the self disintegrates under stress. And in unorganizing, it is the creative stage. That under the control of the ego, you sit back and allow the primary processes, the creative processes to take place. For example, let us say you go to see a movie. Now, you know everybody is being paid for doing what they are doing and it's all on the screen. Nothing is real. But if you have this in the mind as a rational person, you can't get involved in the movie and enjoy the movie. Unless the unconscious processes of identification, love and hate, like and dislike, expectation and disappointment, they take place, you can't really get involved in the movie. So what you do is, for a temporary 3 hours, you put your rational side aside and you allow the fantasy part of you to take over. This is an act of unorganizing.
Okay.
That you put the organized rational self aside for a purpose. Now, this you do in every creative task. And this is a sign of a very healthy ego, that you are able to consciously put aside the rationality and the everyday calculation, giving space to imagination and creativity. Because unless you suspend the reality principle, you can't get into creativity. At least not of a high order creativity. So this is the act of unorganized, which is different from disorganizing, which happens under stress. So
clear enough.
Now, one more idea here. How do you fit in Klein? Now, it's very interesting that if you look at Kohut's ideas of formation of a healthy self, Kohut puts out a list, a mirroring list, an idealization list, an arc of tension list, an empathy list, an impingement list, and so on. If these conditions are met, a healthy self is formed. And the less these conditions are met, the more unhealthy the self is. And the unhealthy self is divided into 3, the psychotic, the borderline, and the narcissistic, and the healthy into 2, the normal and the strong. Now, if you look at formation of the healthy self, there is a very important process happening at an unconscious level, which is internalization of a good, reliable, stable object. And the closing of the split. Now, if you look into all of them, you will see the crisis of the split. And from client's point of view, the split remains open and the internalization of a good, reliable, stable object does not happen for a variety of reasons. Either somebody faces an object loss, or somebody refuses to internalize because of envy, or there is too much of attack from the object, or there is too much of attack because of one's own aggression, and therefore the fear of counterattack.
Where is this happening on the periodic table?
Yeah. So what happens is, let us talk about object loss. Now, earlier the object loss, worse is the pathology. So you will look at very early life object loss in these 2 columns. In these 2, these rows. Now, as the object loss happens later, you go down. Like this would be after 3 months, the object loss happens. The potassium line. That you have first 3 months of very good experience, a very good internalization of a good, reliable, stable object, and then suddenly an object loss happens. And because of that, all these difficulties come up in later life. Now, this can also lead to what happens over a long period of time being trained by people. Do they allow you to foster your creativity or are you repressed? So this line is more like the long-term experience in the family, right? The post-trauma experience, which is long-term. So this has to do with that. This has to do with internalization of good anchors. Did your family have good anchors on whom the family could rely? If yes, you already have a role model internalized and you won't have much problem here. But if you have seen the father himself is not sure, he is not confident, he is not able to take the stress and the responsibility of everyone in the family, then you have not internalized a good father. So the crisis will come when you get into that stage. So this line will be failure to internalize a strong, good, healthy object over a long period of time in the social situation. Like you have not seen your father taking on the role of being the anchor in a consolidated, non-anxious, non-disintegrative way. You see him getting anxious, you see him getting disintegrated. You see him not being successful, not being efficient. You see him trying to avoid being the center of the family, being the anchor on whom all the stresses fall, all the responsibilities come. So you are not ready to be that center because you have not seen that role model, you have not internalized that kind of a solid consolidated object.
So this is where that security and responsibility was overlapping.
Yeah. So this is like you have not internalized a good, reliable, stable object in the childhood. This is like
secure.
This is like you have not internalized a good, reliable, stable object when you are in your teens or young age and the object is in this mid age. So we see the worst of object losses in these rows, the first two rows. So it will be like, this will be like month 1, the object loss happens, or object loss happens straight away, right at birth. Here, the object loss happens first 2 months, first month, or you can always say first month, second month, third month, and the object loss happens here 4th month. It's almost like a month by month object loss story.
Oh.
That this is almost like object loss happens in the first month, this is second month, third month, 4th month, meaning till 3 months the object experience was very good and then the object loss happens.
Okay.
And then what happens post object loss and what is your constitution like? Now this will be like the most delicate constitution and the worst experience is happening after the object loss over a long period of time. If let us say the object loss happens, but after that good experiences follow, the childhood is very good in the family, you will move from here to somewhere here. It will not be a disaster like this. It will be somewhere here. Which means the path to recovery is only 3 places or 2 places. From here, it is a long way to recovery. That if in this case, the normal, let us say, is this, assuming, then you have to pass through this path. But if you are already here, then it is this one.
So my question here is, in case of those individuals who go through this and their strength is enough to sustain, are they somewhere by the grace of universe getting in touch with these elements which are assisting, or they're just in case? Because what I'm seeing right now, it is not just something from outside which is going to fix you. Just there is this play of all of these at certain stages. As homeopathy talks about, if you give it to the healthy person, this happens. If you give it to a pathology to person, this happens. So that means elementally these already are at play.
Correct. So this brings us to a very important point that we are at the fundamental question of what is a sickness and what is healing. Meaning, let us say somebody has had an object loss. After a good 3 months, he is here. And he comes to psychotherapy, and over a period of time, he internalizes the good, reliable, stable object of the therapist. And the arrest which was there in childhood is undone, and he gets healed. Let us say this. Now, let us say the same person goes to homeopathy. And the homeopath rightly finds out he is here and starts medication. Now, what the medication is doing is, in some way, healing the person of the difficulty of not being able to internalize a good, reliable, stable object. That the resistances to internalization are overcome by the medication in some way. It is like healing the same way through two different ways. Let's say you have malaria and allopathy has one drug to heal you. Homeopathic will have second medicine to heal you. And Ayurveda will have third medicine to heal you. So the same result is achieved through three different ways. Now, at a deeper level, it may be that all of them are working on the same thing in different ways, or all of them are working in different ways. For example, somebody can say that the pathogen of malaria can be killed by going into the nucleus and destroying it, and maybe allopathy is doing that. Ayurveda can say it will stick around the pathogen and not allow it to exchange anything with the environment, and still it dies. And homeopathy can say it will activate the vital force, the immunity will go up and kill the bacteria or whatever is the pathogen. So we may be looking at different ways to heal the same thing, or we may be looking at one way to heal, and in some way different approaches are getting equivalent at some stage. Now both situations will arise, but what is important is that we are able to fix something psychological using a substance, a potentialized substance. So this is something very interesting here, that what we say failure to internalize a good, reliable, stable object, somehow that difficulty is facilitated, overcome, healed by using some potentialized substances. So let us continue with the story. Now let us look at the story in another way. That the story is the story of healthy self-formation. If you look at the periodic table, broadly it is the story of healthy self-formation, and the healthy self-formation, in that we'll have to largely use the concept of mirroring and the concept of cohesiveness. Mirroring on the rows and cohesiveness on the column. In between, we'll have to introduce other concepts. It's not a neat application of code. So let us look at this. From that point of view, what is the story? The story of the rows 1, 2, and 3 is the story of self-formation. Story of row 4 is I am not good enough. Story of row 5 is freedom, safety, happiness, and creativity. Row 6, I am not good enough in the group context, the anchor anxiety. And the row 7 is disintegration. Now, if you look at the column, right, and if you look at the hypo, normal, and hyper, if you divide that, then you have the hypocapacity zone on the left, normal zone, and then hyper zone. The hypo is more or less a dependent range, then the normal range, and then the narcissistic range, and then the noble end station. Now let us go deeper. Okay, if you take the next step from the periodic table and include other kingdoms also, plant and animal, then what is the core psychoanalytic story? The core psychoanalytic story in mineral is of self-formation. It is a pre-Oedipal pathology, and theoreticians which are of interest here to explain the periodic table are Mahler, Klein, and Cohut. That we have a stage of primary narcissism or autism, then the stage of I, then the stage of I and not I, then we have the split issues, internalization of a good, reliable, stable object, fusion individuation, and self-formation. So essentially the mineral story is of self-formation, and largely it is a story of Mahler, Klein, and Cohut. When we come to plant, it is the story of ego function. The work of Anna Freud and Hartman. That the core difficulty is affect generation, affect regulation, and pathological expression of the affect. In words of homeopathy, this mineral is related with structure, plant is related with sensitivity and reactivity, and animal with survival and competition. If you put psychoanalytic language, the mineral is essentially a story of self-formation involving pre-Oedipal pathology and theories of Mahler, Klein, and Cohut. Plant essentially is a story of difficulty of ego function, the work of Anna Freud, Hartman, and the ego psychology school. You can also use the heat process and look at the affect generation table, which is very useful in case of plant. Because essentially it's a affect generation and affect regulation difficulty, which results in a pathological affect expression. And in animal, the story is of the split and Oedipus, Klein and Freud. When we talk of survival, attack, pain, torture, brutality, sadism, masochism, these are all split issues. And this is what patients talk. When an animal type patient comes and he talks, these are the words found in his talk. And now we have softwares where you can put in these words and see where it goes. The software can classify. So if you look at this, these actually are split outcomes. That if the split is open, this is very, very natural. Similarly, if the Oedipus is unresolved, the man is going to have problems in competition, castration, triangle, relationship, shame, guilt, being in the society. Now the difficulty is this, and this is where psychoanalysis comes in very handy. Let's say you have OCD. OCD can happen because of open split, unresolved Oedipus, or both. In all the three, you can have OCD. Now, if you know the concepts of split Oedipus and both, and let us say we find some remedies which are causally driven, which work very good on split, very good on Oedipus, and third group which works very good on when both are present. This is very easy to deal with. And then you can bring it and the periodic table, and you can apply the general causality model, the epistemological analysis, and the holistic healing framework from that to arrive at a remedy, to find new remedies, and to analyze the causality. It's not one-to-one, it's a long way to go, but this is the way to go forward. But as you say, the crux is, from psychoanalytic point, the mineral kingdom. The mineral kingdom is the story of self-formation, plant of ego function, and animal of split and Oedipus. Now, what will be important for us is that if there is a problem in the mineral stage, the animal stage automatically will be
Hello.
the animal stage automatically will be distorted. Let me just put a message, just a moment. So, if you put the psychoanalytic story, the mineral kingdom is of self-formation. The core issues from psychoanalytic point are of loss, stability, boundary, adequacy, difficulty of internalization. In plant, it is the ego function or ego effectiveness, affect generation, affect regulation, pathological expression of affect is not regulated, calibrated. In animal, it is the split and the Oedipus, Klein and Freud. Now, very interestingly, if you look at the tree of trauma, we have the concept of the tree of trauma. In some cases, you can go straight to the root. In some cases, you have to go from the leaf to the branch to the trunk to the root. And in some cases, there is one core trauma, but there are multiple equally heavy traumas, or less heavy, but traumas into themselves. So you don't have a one seed plant situation. You have one seed plant, then you have the next seed, another plant. May not be of the same height, but still a next plant, and then a next plant. You have multiple trauma situation. And then what happens is, in case of multiple trauma situation, you may not be able to go directly to the core trauma, because there is something which is called the focus demanding trauma. That in the healing process, there is one trauma which may not be the core, but it demands attention right now. And if you try to neglect it and go straight to the core trauma, it creates some sort of aggravation. Now, this may be the model for one of the models of homeopathic aggravation, we don't know. Yeah, if there are 10 issues causing aggravation, this may be one factor into it. Now, when you put the causality driven theory, you can create this super pathological structure in the unconscious of one trauma, of multiple traumas, one trauma in the front, one trauma in the back. And this is what happens when we say allow the patient to lead the session. What we are saying is that we know the core, but we don't have to directly go to the core, because often it's not possible. There are many issues which have to be solved on the way, and they are best brought out by patient spontaneity and free association. So we allow the patient to lead the session rather than going straight to the core trauma, which by and large we know after some sessions. So if our approach of core trauma going straight to the root is not working, then we have to allow the patient to lead the session. Many people do it. In fact, most do it. One more element, there is also this idea of the good harvesting technique. That whatever is necessary to be done, much of it has to be done by other techniques. Right? The patient has been in allopathy, he has been in pranic healing, Reiki, and homeopathy, and lastly comes psychotherapy, and the patient gets healed. And we try to take all credit, which is not true. We have actually harvested the work of many others. So the last technique which heals often is a good harvesting technique, not necessarily the only technique. In some cases, it may be the only technique, but mostly it's a harvesting technique. What we look at here is that there is an unconscious causation, and this will not come out in proving. Let's say you do proving of something which heals OCD, and the OCD is because of Oedipus, it's not going to bring up Oedipus. It's too repressed. Most people will never feel it. Some of them will not even report it. At the most, you can get some fragments of the Oedipus, but never the whole understanding of the Oedipus from a proving. It's too much to be asked from a proving, because it requires years of efforts. It cannot be done in a proving. So unconscious causation cannot be found out by a regular proving, we'll have to find out some other tool for it. Or maybe those who are trained in this, they get into proving because they already have under much of their repression. So those who have undergone the psychoanalytic process, if you take them for proving, maybe it's easier for these things to come up. Then when we look at heat and homeopathy, we look at the tree of trauma that heat talks about, harvesting technique, uncautious possession, and non-secular factors, which of course as a science we cannot accept in homeopathy. But in heat, the non-secular holistic part of heat we accept, and then the holistic healing framework. That do we use only homeopathy or do you combine it with other things? And if combination, then at what stage and in what sequence? So that is a whole area of heat and homeopathy which we can bring together for mutual enrichment. So this is something on the
periodic table.
Set the periodic table.
Does it not open an esoteric area of psyche and substance, to use Whitman's phrase, in cohesion context?
It does. It does. Because it opens up a very esoteric area of psyche and substance. It also opens up another esoteric area of design in nature, as though for every difficulty nature has created a remedy, either directly or in potential. So it creates this whole philosophical idea of a united organic whole system, rather than we finding ourselves in a disjointed universe. So it brings up this whole idea of organicity and design. It also brings up this whole idea, the whole world of potentialization and what it can do for us. And how stories come real. Many homeopaths used to use in older days Carl Jung's concepts, and they used to use fairy tales of patients and interpret the core of those fairy tales to find the remedy. Not exclusively based upon that, but one of the factors in finding remedy. So it's a very interesting area to explore.
So if overview is taken of the kingdom approach from this side, what actually comes up?
If you, 1 minute to go, can we take this question in the next part?
Yes, sure.